Aloha, this is the Kupuna Connections TV series, and I'm Cullen Hayashida, the co-host for the program. And today we have a very interesting discussion with regards to exercise and fitness for older adults. And with us, we have one guest, but before we get started, let's go ahead around the table and start off with my co-host, Tony.
Okay. My name is Tony Hathaway, and I'm a licensed social worker, and I'm the education coordinator for the Kupuna Education Center.
Dr. Riddell.
I'm Richard Riddell, and I'm an internist interested in general medicine and health and wellness.
Okay, and your background has been quite varied. I mean, you've been into exercise as well as into geriatric medicine as well.
Right. I grew up here in Hawaii, attended Pacific University in Oregon, got my bachelor's degree there, came back home for medical school, and did 1 year of geriatrics fellowship with Dr. Blanchette at Kuakini. And during fellowship, I noticed the lack of exercise and became interested in how exercise might benefit the nursing home patients.
Oh.
So my initial contact or initial exposure to exercise in the elderly was in dealing with institutionalized patients. And I found early on that even if they were elderly, like in 80s and 90s, they had benefits, decreased falls, increased function, things like that.
Oh.
And then when I left the fellowship program and went on to private practice, I just kind of continued to do more research and reading about exercise.
Great, great. Well, let's start out with this whole issue with regards to exercise, fitness, and older adults. So not necessarily just the frail elder, but those, let's say, the boomers as well, right?
Right.
And what do you say? What does the literature say with regards to the importance of exercise?
Oh my gosh. How long is this show? we got like 30 minutes. So anyway, there's so much information about exercise. Exercise, as we all know, will lower blood pressure. Exercise will, of course, help us to keep our weight under control. Exercise is an important part of controlling diabetes, cholesterol. Exercise also improves our bone strength and reduces the problems with osteoporosis. And then there's some other things that we were surprised to find out. About 2 years ago, American Journal of Medicine had an article where postmenopausal women who exercised regularly had less colds, and when they caught colds, the colds were less severe. So that was surprising. We don't know why that happened, so we're still looking at that. And then recently, about 2 months ago or so, there was a project out of McGill University in Canada where they actually found that regular exercise retards those cellular changes that occur in elderly animals. So these laboratory animals that were trained to exercise regularly were found to have lacking these changes associated with age. So they kind of stayed younger longer.
Well, yeah, so that's longevity related in
Yeah,
that sense.
yeah.
Wow.
Exciting.
And I guess, when I exercise, I sleep better too.
Absolutely.
So
That's
that has
true, too. True. Your sleep is better, your focus is better when you're awake. We can do mental testing on mentation and calculation and concentration. Those all improve. Even in people who have dementia, the fact that they exercise regularly will improve those scores.
I remember you mentioned just prior to this discussion that exercise, according to one a professional association of medicine, exercise is medicine.
Right. Actually, two major associations, the American College of Sports Medicine and even the American Heart Association, both acknowledge that, quote unquote, exercise is medicine. It's exciting.
So you've convinced us all now that exercise is important for us to do. But what kinds of exercises are good for seniors?
The main key is to find something that you like, something that's fun, and something that you can be consistent with. So, if I told you to go ahead and you need to balance on one leg and do this kind of exercise and you find it boring, you're not going to do it. So find something that you enjoy. So it may take some time to experiment until you get somewhere that you're comfortable with and having fun. But once you get there, then you want to think about 3 types of exercise or 3 types of programs. One is for aerobic capacity, and that's where you are able to improve the we call cardiovascular conditioning, so your overall stamina. That's one type of exercise. Another type is strengthening, and that's typically with weights, things like dumbbells or these resistance machines or bands or medicine balls. And by working with that, the muscle strength improves, and that has its own benefits. The third thing that's important, not so readily acknowledged in the older person, is flexibility. But stretching regularly, within reason, is very, very helpful. It helps with, and putting a program together that encompasses or includes all three components is important, because you then get benefits for your heart, benefits for your muscles, and for your bone.
Where does balance fit into all of this? Is that considered like an exercise too, or some? You hear Tai Chi and that
Actually,
sort of thing.
yeah, that's important. Tai Chi, Qigong, they're all important. They're not like typical, when you think of balance exercise, it's not like standing on a balance beam and that's the focus of it. But by doing these motions slowly and all that, you're working your core and you do improve your balance. So balance is a benefit of regular exercise.
You hear that word core a lot. What does that mean? What's your core?
Okay, the typical American male wants to work our shoulders and our biceps and look nice and big and everything. But the important part for us is the core, pretty much from the diaphragm down to the buttock area, because that is where we get most of our strength, where we can control the balance and our posture. And working the core by keeping your stomach muscles stronger, keeping your back muscles good, helps in the other activities as well. You tend not to have as many injuries by keeping your core strong. You hear of people who just exercise on weekends, those weekend warriors, and they often get injured, back pain, back injuries, and oftentimes they don't work their core, so they're focusing on the other areas. So core is important. By working your core as well, you can actually improve things like your gastrointestinal function, so you get more regular, which is good. And anecdotal evidence suggests that by working the core, even libido and other marital functions improve.
I see. Okay. Okay. So when we talk about exercise, then how often should we work out? I mean, is it something that we should do every day, or what's enough?
Okay. Recommendations by the American Heart Association are for about 150 minutes per week of moderately intense exercise. That's so vague, but by jogging or walking briskly, combined with some aerobic activity like yoga or Zumba or Tai Chi or Qigong, 150 minutes in total per week should be sufficient. Working out daily actually can be counterproductive, because you can risk injury, you can risk overtraining, and then you get yourself set back for weeks.
150 hours?
150 minutes. So that's 2.5 hours a week.
2.5 hours a week.
30 minutes 5 times a week, or 45 minutes 3 times a week. So it's not that much.
Should you do enough so that you actually break out in sweat? Is that important?
I think breathing, if you can break out in a light sweat, that would be nice. If you can work to the point where you're breathing moderately hard, kind of huffing and puffing would be nice. That's a nice internal guide to know how intense the exercise is. If you're, for instance, if you're walking and you're talking stories and you're reciting the whole Gettysburg Address without problem, then you're probably not going fast or intense enough. But if you're walking and you can't talk at all, then you probably should slow it down a little. So that's a nice guide. Some people will use heart rate as a guide. In people our age and above, sometimes that may not be effective because of medication effects. That may not be effective because of intrinsic damage to the heart from before. Sometimes the heart just can't pick up the rate. So talk with your doctor about the heart rate itself.
Yeah, I guess getting people involved into in some kind of exercise schedule, that's a tough sell oftentimes. People have difficulty making that transition.
Right.
You mentioned finding something that you really like, but how do you find that?
Oftentimes hit and miss. people who are intent on finding something have sometimes gone through 3 or 4 or 5 different activities before they find something they're comfortable with. And it's not just the activity itself, it's the people who go there. So having a partner is important, a workout partner. Sometimes the environment itself is important. Schedule, There may be a type of class that you want to attend, but it's at 9 o'clock at night and you can't make it. So all those other things come into play until hopefully at some point you find something that you can stick with.
Well, so I'm already taking my medicines like I'm supposed to. If I have high cholesterol or high blood pressure or I'm diabetic, is that enough? Do I have to exercise too?
Gosh darn it, yeah.
Oh, shucks.
Actually, if you look in the PDR, that physician desk reference, under any medication for blood pressure or diabetes or cholesterol, it will say that this drug is meant as an adjunct or as an aid or assistance to lifestyle changes like diet and exercise and weight control. So absolutely, yes. You should really embark on a regular exercise and lifestyle program, not only to maybe reduce the need for the medication, but also like we talked about earlier, there's the other benefits, the sleep, the mood, strengthening of the bones, things like that that are not things that are treated by your blood pressure medicine or your diabetes medicine.
I see. So you need to do both.
You should do both.
And then as far as diet is concerned, then we still need to watch our diet as well if you exercise.
Yes, we should.
There was this one guy that I knew, and he said, I'll eat anything I want, but I work out every day. And that sort of keeps my weight down, but it allows me to eat some junk food every day, or lots of gravy on my hamburger and that sort of thing. What do you say about things like?
Actually, he's not that far off the mark. If he's really active, if he really exercises regularly, he can eat a lot, and you can enjoy food. As an example, the Tour de France, those bike riders, when you look at how many calories they'll eat per day during the race, it's between 8,000 and 10,000 calories per day.
Really?
Right.
Wow.
But they're burning it off.
Yes, yes.
Most of us are not nearly that active. So if your friend can do that, great. Still be aware of monitoring his cholesterol results if he's eating all the gravy and things like that. The bigger issue I see with patients is when they tell me, well, I'm taking my medicine, so then I can just eat whatever I want, and they're not exercising. And then that's really self-defeating because, again, you're not getting the benefit of the exercise. So, yes, if you're really active, you'll find fantastic benefits. You can eat more. In fact, you will probably have to eat more because otherwise you'll start to lose weight.
I see, I see. Now, you have any stories or some examples of people that have actually gone through this process? Maybe someone that was in fairly poor health, perhaps, and went through this kind of significant training and made a huge difference?
Actually several, and for confidentiality and privacy's sake, I can't give their names. Yeah. But I've had several people who have actually gone off medication with continued monitoring. So, there may be a chance in the future that they have to restart one of them's on diabetic medication, or was on, and we took him off. Some other people have gone off of blood pressure medication, but they still need to watch their lifestyle. They still need to watch their salt intake. And they're exercising, they've lost a lot of weight, doing well, feeling good.
Completely got off their
Yes.
diabetes?
Right.
Wow.
What we need to realize, though, and remember, is that although we may go off the medication, it doesn't mean that the condition is gone. So it's not like a headache where you take your Tylenol and the headache's gone, so you don't have to worry about it. This exercise, lifestyle change, salt avoidance, watching what you eat may result in you going off meds, but you still need to take care of yourself and you still need to eat wisely.
They must have had to do a lot of exercise in order to get to that point, huh? No, not
Actually,
necessarily?
not that much. If you talk to somebody who's on a well-balanced program, they'll start exercising, but they'll also be more aware that, if I eat this, then I'm going to have to exercise more. So then they also cut down on the diet a little bit. They also cut down on the sweets and the snacks. So moderate changes throughout is good. Excess in anything is no good. So too much exercise, like I mentioned earlier, is no good. You can get into the problem of overtraining and exhaustion. Is it okay if I bring up about overtraining and exhaustion?
Go ahead.
Absolutely.
One thing I've noticed in working with people in exercise is, especially the men, and I apologize for this, but the men will tend to remember what we could do in high school. And we could run a mile in so many minutes in high school, and unfortunately we're no longer there. So they try to do that and they get hurt, or therefore they overtrain. And I see them get injured, they're out for a week or 2 weeks or longer. So women are more reasonable and they kind of take it slower and gradually increase their intensity. So it's something to watch for. But when people do overtrain in general, sometimes they become irritable. Their sleep actually gets worse again because they're exhausted. They may start losing weight unnecessarily or worrisomely, so much weight that something's wrong, and then you need to tell them to back off.
Well, how safe is exercise for seniors? You sort of led into that with some of your talk about overdoing it. How about if you've had some kind of a condition, like maybe you had a small stroke and you've gone to rehab? Are you supposed to still continue to exercise once you get home?
Yes. We actually work with many patients who have had similar events, either a stroke or a heart attack. They went through their rehab, and following completion of that formal rehab that's covered by insurance, it's wise for them to continue on a regular exercise program. So depending, for example, about your question about the stroke, depending on what part of their body has been affected, there's a lot of different exercises that can be done to kind of keep them in shape, keep them strong, keep them safe. And again, we'd have to kind of look at each case and see what their deficiency or defect is at this point in time before we can recommend a real program. But yes, absolutely. Following any major event, heart attack, stroke, we really should get on an exercise program and stay on it.
Well, how about using weights? Is that okay for somebody that's had a heart problem of some kind, or?
Yes. A few years ago, the consensus was that no weights for older people, especially if they had open heart surgery, because of, actually as I think about it now, the reasons are not clear, but I guess people thought that by working with weights after open heart surgery, you'd injure yourself more, but the data's coming in now that even these people need to exercise. Weights are good. Now, we're not going to do what we did in high school, but we can do a regular, increasing, graduated weight program with good effect. Working with someone who is attentive to your needs and responsive to your questions is important, because then you get that confidence and you can kind of work out, more safely.
What if somebody is elderly and their family has said to them that they're worried that they shouldn't exercise because it might hurt them?
Let me talk to the family. I'm just kidding. Let me give an example, a specific example. My father, very active man, kept running till late in life, jogging and all that. But when he was much younger, I was a little boy, he was told by a heart doctor that he could no longer work because for some unknown reason. And I was too young to know, but he was real depressed, was told again he had to retire medically, would be too dangerous to be active. And then he eventually got so frustrated he went and got another opinion from another cardiologist who told him he disagreed totally, get back to work. My father's a longshoreman, very active lifestyle. And what was worrisome in this case was that my dad was almost going to become what we call a cardiac cripple, where because of heart concerns you do nothing. And that would have been horrible if he didn't get that other opinion. So to make a long answer a little shorter, yes, even heart patients, even elderly patients, especially elderly patients and especially heart patients should get into an exercise program. Something graduated, something modified according to their needs, and with someone helping them, and they will be very, very safe and very, very beneficial.
Well, you mentioned that actually when you started out, you started working with very frail elders who are
Very
in the
frail.
nursing home, and even for them, it's important to move their limbs. say.
Absolutely. You're a social worker, so have you worked with the geriatric population?
Right. Yeah, that's kind of my area.
So it's exciting about the studies. I'm not sure if you had seen that specific one when they did the mini mental status exams. Some of them, this is a test where they kind of get a fairly, not rough, but a good guide about, estimate of their level of memory impairment. And with regular exercise, they've seen significant improvement in those. Yeah.
Yeah. Yeah, I recall even, this is several years ago, so New England Journal of Medicine, there was this article about fairly large sample of people that was tracked over time in nursing home patients, and that were doing some small weights, over time, and there was that kind of significant change that had taken place. So even with that, the very old and very frail population, this helps.
Significant benefit. And before I forget, that also leads to one other benefit of regular exercise in the senior population is that people who exercise regularly can stay home longer. They don't have to be institutionalized as early. They can be more independent. And that's a big thing. We don't want to end up in a nursing home unless we really, really have to.
Absolutely, absolutely. So it's really never too old to start.
Never too old to start. Get into a program where you can have guidance and you can have coaching and get into some kind of program that you're comfortable and something that you can have fun with.
Yeah, and the point that the coaching piece might be an important one to prevent injury, like you mentioned. Huh?
Yeah, very much so.
Now, how about in situations where people are concerned about the fact that in older age, perhaps their knees are not as strong as before. They're concerned about perhaps we hear people having knee replacements, meaning so you got some wear and tear going on. What do you say about people like that? As far as walking and running and that sort of thing. Are we going to sort of create more problems for them down the road?
We would create more problems if we had them do no exercise, actually.
No.
In fact, when people have had knee replacements or hip replacements, what does the surgeon do? Surgeon sends them to physical therapy to get them active again. They've got data, just tons of research articles showing how if you've had surgery and you do bed rest, the outcomes are much worse. So immediately after surgery, they're doing physical therapy. That should be continued after discharge and probably for the rest of their life.
Well, tell us about the Club 50 fitness program.
Oh, thank you. As a result of my interest in exercise in the elderly person, I looked into a way to get people to exercise. Many of my patients who are in the senior population felt uncomfortable going out to regular gyms, which are fine. If you go to a regular gym and you get benefits, go for it. That's good. But some people are not comfortable there and they want a little higher level of monitoring, a little higher level of coaching and hands-on approach. So I thought, well, if we can start this program where we'd be there, helping them to do that might be useful to them, and it would be fun for me.
Well, I think we have some pictures.
We
to
do
show
have
from-
some pictures
from the program.
that we can see on our screen. You can see here we have some photos. Perhaps Dr. Ridal, you can fill in what we're seeing here.
Yeah, these are actual shots from our facility on King Street, and this lady, let's call her Mrs. A, and she's on one of our pieces of equipment, elliptical machine, and that's a machine that gives cardiovascular fitness and also at the same time works on the joints, the knees, the hips, and the arms. You can see she's grabbing the handles. It's not like a treadmill, so she doesn't have to worry about it pounding on the knee. Now, these other gentlemen are on their bike. It's a recumbent bike, so we don't strain the back so much, but at the same time, they can get the heart rate kind of working up a little bit and work their leg muscles at the same time.
Okay.
This is a stair stepper. for strengthening the quads and the gluteus muscles, and it can go the other way where this lady would be turning around and working her buttock as well.
Okay.
Somebody else who's also on the treadmill. Notice how they're all smiling, having fun.
Ah, good.
Yeah. And then in the middle of our gym, we have a circuit with different types of resistance exercises. We can work the biceps and the triceps and the upper body as well.
Okay. And then this last one, we have just some phone number here that in case anybody has any questions.
Right. I'd be happy to answer their questions, or they can come down and check the facility out. Our number is 593-9292. Okay.
So this is called the Club 50 program, something that that Dr. Ridao directs, and it's directed towards the older adult, and hopefully we can sort of create a movement in Hawaii to get more boomers and older adults involved with exercise. As you mentioned,
exercise is fun. Exercise is medicine, actually.
Exercise is medicine.
I'd like, if I have a few seconds, just as a reminder, Medicare Advantage, Kaiser Senior Plan, they all pay for memberships.
Okay.
So talk to your insurance provider and you can get free exercise.
And one last tip for our viewers.
Whatever you do, have fun with it, exercise regularly, and be consistent.
All right. Thank you very much, Dr. Ridao.
Thank you.
And again, this is the Kupuna Connections TV series, and we have been talking to Dr. Ridao about exercise and fitness for older adults. Thank you again for watching, and aloha.